Hi and welcome back to MHC Pain Week. I'm Dr. Jonathan Herald. I'm here to answer some of your chronic pain questions. So that's a good question. Chronic pain can be overloading. It can be the focus of your attention, and it can be all you think about 24/7. Sometimes it can be difficult to think about anything else other than the chronic pain. However, a multidisciplinary approach to pain management is generally the way to go. We want to try and attack it from multiple pathways: psychology, physiotherapy, medications to help get things started, TENS machines. These are all the different modalities that we use to try and tackle chronic pain, partly to get you focused on something other than the pain, and also to help you rehabilitate, to concentrate on making yourself a stronger person mentally and physically to fight your chronic pain. So I have patients like that I see every week in my practice. I'm an orthopedic surgeon and I treat a lot of people that have chronic pain. Sometimes it can be because we haven't done the right test. Sometimes you've only had x-rays and it's a soft tissue injury and you need MRI scans. Sometimes you need weight-bearing films, like when you're standing up, the discs show and they're pinching a nerve when they don't show when you're lying down. Sometimes you need a functional test, something like nerve conduction studies. You might get an MRI scan saying the nerve is not damaged, but then nerve conduction studies will show that there's a blockage to the flow of the nerve. So it can be a matter of doing more tests or finding the right person to suggest the right test, and that can involve getting specialist opinions from multiple other specialists, pain specialists, neurosurgeons, orthopedic surgeons. In the world of subspecialty medicine that we're in now, one person doesn't always have all the answers. However, the second possibility is that if we can't find an organic cause for the pain, it's possible you have neuroplastic pain, which is pain that is an altered sensation that you're experiencing as a result of abnormal nerve flow. And I guess that's another topic to discuss with your GP or with the men's health clinic doctors. Well, this is what we've found has been more successful is a multidisciplinary approach. It's not just a matter of a doctor providing tablets, because what happens is the tablets that they provide may work to start, and then your body gets used to it or tolerant to it, and then you need stronger tablets and stronger tablets and stronger tablets. And as these tablets basically knock you out, although the common philosophy previously was rest and you'll get better, sometimes resting results in your muscles getting weaker and you becoming mentally and physically deconditioned. So the idea of the doctor and the medications is only one pathway in rehabilitation from chronic pain. We need to also build up strength, build up core strength. For example, if you have a bad back, building the strength of the muscles around the back will help support that back. Mental strength, being mentally tough, will allow you to turn up each day to do your exercises, to turn up each day with a positive attitude, to turn up each day and block out the negative pain sensations. And that's, I guess, part of the mindfulness that a psychologist can provide. And a nutritionist, what we eat is very important in helping us recover. Sometimes things like diabetes, which is a condition that can sometimes occur as a result of being overweight, can affect nerve pathways and affect healing simply by the fact that we have poor vascular supply and higher levels of sugar in our blood. So don't underestimate all of these other factors. Try and work on a sustainable project, because this could be something that takes days, weeks, months, years to recover from the chronic pain. And it's important that this journey starts and progresses with things like physiotherapy and strengthening and nutrition, rather than medications that could be addictive or affecting your liver and your kidneys and so forth. Well, chronic pain, by definition, is essentially pain that has progressed beyond the normal healing time of a condition. So in general, bones take about 6 weeks. In general, ligaments and tendons take about 3 months. So if you've got pain for roughly more than 3 months, then you could fall into that definition of chronic pain. Certainly by the time you've hit 3 years, one would think that any organic pathology, an injury should have healed by now. Hence, you would fall into the definition of chronic pain. So that's interesting. TENS machines work a little bit similar to the gate theory of pain. They provide a stimulation which almost helps distract the nerves from feeling the nerve pain. So they're quite good for various different types of pain. Do they work for everyone? No, but as a part of a multidisciplinary plan, they are safe. They're not addictive. They're not going to cause toxic effects to your liver or your kidney. So I think it's worth pursuing, or at least trying. So this is a common problem. Relying on painkillers is not the solution, because what happens is your body gets used to those painkillers. Then you need stronger painkillers. Then you need stronger painkillers. And as your body is getting given more and more painkillers, your pain threshold is dropping, your general physical and mental fitness is reducing, and you're not really rehabilitating from the pain. You're more or less trying to mask the pain with a Band-Aid solution, which is a painkiller, to give you a short period of relief. The reality is what you need is a rehabilitation program. And that's, as I said, multidisciplinary in approach. It could involve core stabilization exercises, could involve a physiotherapist, a nutritionist, a psychologist. All of these methods can help refocus your perspective from temporary relief from painkillers to rehabilitation from chronic pain. Pain that has persisted beyond the normal healing time of an injury can be considered chronic pain, and the arbitrary figure of around 3 months is used for that definition, simply because by that stage most bones have healed and most ligaments and tendons have healed. Muscle pain, there's multiple ways to treat muscle pain. Physiotherapists can provide treatment to strengthen that muscle so that it doesn't become painful with day-to-day activities. But to help with the muscle pain, massage, heat, there are creams that you can apply, TENS machines, and then medications can be used. If the muscle pain is due to anti-inflammatory tablets, inflammation, anti-inflammatory tablets can help. The list is endless. Muscle pain, there's multiple ways to treat muscle pain. Physiotherapists can provide treatment to strengthen that muscle so that it doesn't become painful with day-to-day activities. But to help with the muscle pain, massage, heat, there are creams that you can apply, TENS machines, and then medications can be used. If the muscle pain is due to anti-inflammatory tablets, inflammation, anti-inflammatory tablets can help. The list is endless. Being a shoulder surgeon, that one's right up my alley. Usually it's painful for about 6 to 12 weeks afterwards, requiring medications. And then after about that, it becomes activity-related pain. For example, sleeping on your shoulder causes pain, lifting overhead causes pain. And then it's a matter of building up the strength of the muscles after they've been repaired with surgery, so that, for example, if lifting 5 kilos causes pain, once you've built up strength to lift 7 kilos, then lifting 5 kilos won't cause pain anymore. So it's a matter of building up the strength of the shoulder muscles to be able to cope with whatever loads are getting put through it. Tingling pain is an unusual type of pain sensation. It's generally associated with nerve pain, tingling, numbness, burning, and that could be an indication of nerve pain from a pinched nerve in your neck. For example, if you're lifting your shoulder and you're hitching your shoulder, you could be putting extra pressure on your neck. For example, that could be pinching a nerve, or it could be due to irritation or compression of nerve and a number of pathways anywhere between the neck and the fingers that could be causing tingling. That's probably the most common cause of tingling type pain. And that's all the questions we have so far, but thank you very much for tuning in to Men's Health Pain Week, and I hope you've learnt something. Have a good day.